Welcome back. The Body Beautiful plastic surgeon, Dr. Joseph Mele, is here with us today, and we're talking about eyelid surgery. First, let me remind you that we'll be taking your calls live on the air with any questions you have for Dr. Mele about plastic surgery. Here's the phone number, 800-440-4884. We'll also be posting his number during and at the end of the segment. Remember, any advice we give you today, you're going to want to consult your own physician as well. Okay, technically, it's called let's see if I can get this out, blepharoplasty.
Blepharoplasty, yes, or eyelid surgery.
Eyelid surgery.
Yeah.
It's pretty common.
Very common. Yeah, it's usually
men and
in
women.
The top 5, usually 2 or 3.
And I want to emphasize here, men get this done.
Yes, yes. Yeah, and for various reasons, not just for appearance. Sometimes the eyelid is actually obstructing part of the visual field and making it harder to see.
Okay, so would insurance cover this?
If it's obstructing the visual field, usually the insurance companies will have some sort of screening process to look at the visual field and see where the obstruction is. Most commonly, it's the lateral visual field, the outer part of the field. Sometimes it's the upper part of the field that has trouble because the weight of the eyelid is just pushing the lid closed.
And so basically, what do you do to
The most common thing that we're doing with blepharoplasty is getting rid of the excess skin and to some extent excess fat in the eyelid itself. So when the eyelid skin becomes redundant, it starts to fold over and may start pushing on the eyelashes, and then it can actually weigh the eyelid down. Basically what I'm doing is pinching out what's extra, getting rid of that, and then we leave an incision right in that fold where you can't really see it.
Well, actually, doctor, a friend of mine did that to her dog because it was affecting the dog's vision.
Yeah. I mean, it happens. My sister had a Shar-Pei, which has very wrinkly skin, and the eyelid tends to wrinkle enough where the lashes start to scrape the cornea. They start to rub in the eye. Her dog had blepharoplasty.
Okay, well, but there's another type of blepharoplasty that also just gets rid of bags. There's upper and lower.
Yes, the upper usually is more excess skin. Lower eyelid more commonly is excess fat, and the fat it's not really a hernia, but we call it pseudo herniation, which is it's not real hernia, where the fat comes forwards and makes a bag, makes fullness.
But there's so many products on the market, the creams and the promise to take away the dark circles in the bags. Does anything work? Other than
you know, some of them are effective, but a lot of them that really do get rid of the bags there, they dry onto the skin and kind of tighten. And I found patients find that uncomfortable.
How about a good night's sleep?
Sleep is very helpful. Very helpful. Hydrating oneself.
Well, and drinking before you go to bed. Drinking, and I mean, say if you have wine or alcohol, doesn't that?
Yeah, probably water's better.
Right, water's better, yeah.
Yeah, alcohol tends to be dehydrating.
Now, why is it when you cry, eyes get puffy?
Well, it's a type of inflammation. So when their eyes are when we get sensitive, either emotionally or we get something in our eye, there's a little inflammation that happens. So the eye tears more, and the idea is to flush things out. Okay,
and so after you've had the blepharoplasty, even if you cry, you've had late night and perhaps partying too much, it's not going to show.
You can still cry, but there is a certain thing that can happen after blepharoplasty that's important to discuss with your doctor before having done, is that sometimes the eyes will be a little more dry. And it may be just physically because they're open more. It's very common temporarily after surgery to have some increased dryness in the eye, to the point where if people have very dry eyes before eyelid surgery, I may want to do only the uppers or only the lowers at one time, even if they need all 4 lids done, and then come back at a later date and do the others.
So what, would you have a lifetime of putting in drops?
There are some people who have a lifetime of putting in drops and putting in ointment at night.
Okay. There are different techniques, I understand, that if you're going, sometimes you can actually just make an incision on the outside, other times on the inside, so it doesn't even show. I
tend to go on the inside more in younger people who the skin has good elasticity, it's going to recoil, we can get rid of that bag and the skin's going to tighten up and look fine. As we age, the skin becomes a little more redundant, and that extra skin I can remove with the outside incision. But even that incision, it's right underneath the lashes. It tends to be very difficult to see once it's healed.
But it begs the question, would that kind of tug down and kind of create a little...
Well, that would be the wrong way to do it.
That would be the wrong way, okay.
Yes.
That's a bad one.
But it can happen. There are some people who have, let's say, large tumors. They have skin cancer on their eyelids, where we have to physically remove more skin than we would for a cosmetic operation. In those cases, there are other little tricks that we do in order to tighten the eyelid to reinforce it. But when I'm taking out skin, I'm usually taking out a very small amount. It's not so much that I'm going to pull the lid down. I remove the majority of it from the outside and actually pinch across, which supports the eyelid and has less likelihood of causing that sort of problem. Okay, I have a lot more questions about this, but we've got to go to a break. But for more information about Dr. Joseph Mele, you can call him at 925-943-6353 or go to drmele.com. When we come back, we're talking about your eyes and what we can do to look a little fresher, I guess. We'll be taking your phone calls as well when we come back.